Hello, I'm Dr. Grant Cooper from Princeton Spine and Joint Center. This is Dr. Brasilovich, my wife, also at Princeton Spine and Joint Center, and Dr. Jensen, our physical therapist extraordinaire with us today. In this video, we're going to be talking about and showing exercises for neck pain. And so with that, I turn it over to Dr. Jensen.
So these are my favorite neck pain exercises. Again, everyone has a different reason why they have neck pain, but these are usually pretty tried and true. Will probably work for just about everyone to address something without irritating it. But again, get a full exam by a doctor or a physical therapist to make sure that these are appropriate. All right, okay, so we're gonna start with a few exercises to get the muscles in the front of your neck recruited. Because if you've been on a computer for a long time, which a lot of people with neck pain have been, or just any type of neck pain, the muscles in the front of your neck stop working the way they need to. So the ones in the back are the ones that get all sorts of tight because everyone's here all the time. So to re-recruit the ones in the front, deep cervical flexors, anterior cervical flexors, there are a lot of fancy words. We're gonna
It's not
try.
something people think about a lot, right? They don't,
Right,
it's not something you think about with your neck a lot.
You have muscles in the very front of your
Right.
spine that keep it here, and there's other muscles in the back that push you forward. So this is where a lot of neck pain comes from, is either turning these off from a neck, whiplash associated injury, just postural dysfunction, all of those different things. So this is kind of tried and true for anything. So I'm gonna have one of you lie on your back,
You want to go first? Okay.
face up. And first thing to find is just a neutral position. So can you pull your chin to your throat? And you could bend your knees. Actually, bending your knees puts your neck in a more neutral position. It takes the tension off your back, which you probably feel already more comfortable. So you're gonna pull your chin down. And I say chin to your throat because you're not putting it to your chest, but you're gonna feel the lengthening in the back of your neck, like right underneath your skull. You feel that? And then you should feel a little bit of work maybe in the very front of your throat. So that's step one. If that's challenging enough for you, stay there and just kind of work on that, holding it for longer periods of time, making sure you can breathe naturally while you're in this position. So if that's pretty easy for you, then what you're gonna do is add a little bit of a lift, almost like the thickness of a sheet of paper trying to slide underneath your head, just clear the floor. Yeah, it's a little bit much, but it still works as long as you're feeling the front of your throat working, trying to breathe as neutrally and naturally as you can. And then when you get tired, you'll start to feel the back of your neck kicking in, and that's when you relax.
Is that hard on it?
I feel it most of all in the front,
Yeah.
and I can feel a little getting shaky.
Yep,
Yeah.
so some of the shakiness, you really want to keep that chin glued to your throat. If that starts to get lost and you can't maintain it, your head starts to bob, or it feels like an elephant standing on your head, you probably need to take a break.
Such a good exercise.
Yeah, and you'll feel your abdominals kick in too. You should with this. If not, that's
I
okay.
feel my ribs freezing.
Yep. So you hold this. I mean, if you can only start with a few seconds, some people can only do a beat, a second, then relax down. Dr. Anna's doing pretty good, so relax. But it's an endurance
It's such
test.
a new feeling.
Yeah.
You don't do this during the day ever.
No,
Ever.
yeah. Whenever you're on the computer talking to people, typically you're pushing your head forward. You're straining to look at the computer screen. So really re-educating the muscles in the front and telling them, hey, this is what you're supposed to do.
So it's not reps you're doing here. You want just one contraction up and you're holding it, or
So-
is this you repeating this over? And
It's an endurance exercise. So the more your neck can maintain a neutral alignment throughout the day, the better off your neck is going to feel. So ideally, you can hold this for about 2 minutes without much trouble, but a lot of people can't do that. And then you need to work on reps because you can only hold it for
Got
2
it.
seconds, 5 seconds, 10 seconds. So I usually tell people practice this for about 2 minutes a day, and however many reps you can get in without feeling the back of your neck getting really tight,
Yeah.
work up to the 2-minute time limit.
Something that surprised me when we did therapy the first time was how much just turning on the muscle means.
Yes.
You don't necessarily have to be strengthening it per se.
Right.
It's just teaching it to actually turn on. It's
Activate.
actually
Yeah.
it's a real thing. You have to.
Yeah. So you
That
may,
the
when you're
neuromuscular
going through these
connections are,
exercises, you may not feel those muscles working at all. And that's where that brain needs to actually connect with them. So doing an exercise, just multiple reps without really knowing what you're doing or feeling, that's kind of setting you up for failure and not success, because then there's no purpose, there's no reason to what you're doing, and your body has no clue what it's actually processing. So step one is always know what muscle you're supposed to be working, where you're supposed to feel it, and then once you're actually doing that exercise, can you feel that muscle? And if you're not, then we need to regress it, make it easier, or start with something completely different to be able to do that.
Okay.
So that's step one.
The next one?
Yep, so the next one, I would say let's go into that thoracic mobility. We did this for the low back pain, but it's right next to your neck. So cervical spine is here, thoracic spine is everywhere that your ribs attach, so it's right below it. So if your neck is hurting, maybe because the part of your thoracic spine is not moving. So you're gonna lie on your side, pick a side, any side. We're gonna do both. The joints of your thoracic spine are bilateral, meaning there's one on each side of your vertebrae. So bringing your knees all the way up blocks out your lumbar spine. Your arms are gonna be out in front of you. So these are like two covers of a book. And you're gonna rotate your one arm all the way behind you. Good. So you feel a stretch in your upper back. Do you feel that?
Yep.
So if your neck is uncomfortable because you have neck pain, you can either choose to look at your hand and that might feel good, or you can choose to look at your other hand and not twist your neck. So whichever one works for you. And then at the end range of that stretch, take a deep breath in and then let it all the way out. Exhale, try to reach a little bit further, and then you come back. Good. So then I do about 10 or so reps on each side, as long as they feel good and you're making progress, meaning that you're feeling it loosening up as you repeat more.
Okay,
Got it.
nice. All right, on
So,
to the next one?
book opener, yep.
Yeah, book opener.
All right.
I love that one. For the lower back, I did that. That was one of my favorites.
I mean, if you really think about it, your thoracic spine is the center of all the different, like your extremities, your legs, your low back. So addressing that with almost any pain location is usually
Yeah, we
Some
don't say
do.
it's so underutilized for breathing, and we say you're
Yes.
using your ribs to breathe this way. but
Yes.
Really, we mobilize that thoracic spine hardly ever.
And most people, when they have neck pain, they're breathing up here. So their ribs are elevating. That's one of the reasons why your neck gets tight. So if you have no rib mobility, excursion through your rib cage, there's nowhere else to go but up here, which is why your neck hurts. So if you can get your thoracic spine moving, maybe that's the only reason why your neck hurts, because it doesn't have anywhere to go. So that brings us to the next exercise, which is a shrug. So a lot of people think, oh, why would I use the muscles next to my neck to calm down my neck pain? Aren't we supposed to stretch your neck? A lot of people don't really respond really well to stretching necks, and it's not because the neck is tight that it needs to be stretched. It's tight because the muscles aren't actually working in it and they need to relax. So when you're not using a muscle for a long time, it's trying to hold on for dear life, and it's getting really tense because it's weak or inhibited. So actually turning on those muscles and strengthening them in a way is gonna be what relaxes it. So you could take any two weights. You could find, water bottles at your house, something with some sort of weight, and you could do this in kneeling just so we can get in the frame. Holding those weights at your side, you wanna use the 8s or those. Depends on how long your arms are. There you go. So what you're gonna do is you're just gonna shrug your shoulders straight up and then relax down. Good. So after a few, you should feel these muscles, your upper traps, your levator.
So this is a
scap.
rep. This is a rep one.
Yep.
This is it.
Yeah, this is more of a rep one. So hold it for about a second or two, make sure you're feeling those muscles work, and then relax down. If this does hurt your neck, you may need to do a different exercise prior to this, but this is a good place to start.
I feel like I would need more weight.
Yeah.
Is that just because I haven't done many reps yet? It'll get harder
Potentially,
as-
yeah.
yeah.
You're also a pretty strong guy, so more weight may be good. These are pretty strong muscles, believe it or not. You can hold really heavy things in both hands. Who carries a ton of groceries into their house all at one time? So, yeah, you can lift a good deal of weight with these.
Yeah, maybe having good technique too. You're keeping your shoulders open,
Mhm.
rotating your shoulders in. I'm sure if you get
Exactly,
tired,
like good
Yeah.
posture,
down.
pull wide. You got it. So that's a shrug.
Nice.
All right, so really simple. And
Basically
then,
until failure, or until close to failure.
honestly, this is more that muscle recruitment kind of exercise initially to calm down your neck. So if you're if you're feeling a lot of tightness, try a few with some weight and see, okay, after that, does my neck feel better? And if it does, great. You probably can stay at that weight and just do that. If you want to become, if you really want to strengthen these muscles, then you can kind of increase the weight, work to
okay.
failure, that type of thing. But if you're really in pain, you're not trying to max
So this
out
is a
right
good one
away.
to calm down the inflammation.
Exactly.
It is
yeah.
sort of counterintuitive.
It is very counterintuitive
Yeah,
to what
yeah.
a lot of people would think, but
Okay.
believe it or not, it works really well. So I've got two other options. I'm thinking an abdominal one or that wall angel, but we could do both.
Why don't we give them a bonus? To do
We
both?
could do both. We can get bonus. All right, so the reason I say abdominals is because we were talking about earlier where your rib cage expansion in order to breathe is an important part of being able to not breathe up here and hike your shoulders up. Abdominal recruitment and getting your diaphragm moving and breathing is a really important thing to calm down your neck. So who wants to take this one? Great. All right, so lying on your back. So we're going to do some breathing into some abdominal transverse abdominis contraction. So first of all, can you belly breathe? So breathing in through your nose, can you inflate your abdomen and kind of let your ribs come out? So if you put your hands under your rib cage, when you breathe in through your nose, those ribs should kind of move outward. So you're 360 expanding your rib cage. And then your diaphragm is moving down as you do that. And as you exhale, everything kind of shrinks and gets smaller. And you might be surprised how this already might start to relax your neck because you're focusing your energy to your belly. Perfect. So then if you can get that breathing under control, then let's see if you can do some abdominal work to brace your abdominals while breathing that way. So really simple way is that pelvic tilt, keep your low back to the ground. Perfect. And then can you maintain your pelvis really still so it doesn't tip? And can you lift one leg up just a little bit and put it right back down and then lower it and then alternate. Left leg goes too, so you feel those abs kind of kicking in to support you to keep your pelvis from tipping.
Is that hard to keep the pelvic tilt while you do that? Huh? She's concentrating.
She's very focused.
And the pelvic tilt again, because we talked about this with the back pain one, but it's about taking away this.
It's about taking away that
right?
space. And
Yeah.
everyone has a range of neutral. So when you have low back pain, sometimes it's so easy to use those low back muscles that I really kind of make sure people aren't using them at all. And I aggressively come into a posterior pelvic tilt. But some people can kind of brace in a neutral position without having to go really far back.
Okay.
But that's for the critics of the video. You're like, it doesn't have to be perfectly against the floor to be effective, but a lot of people just can't do that and control it, so I'd rather be safe than miss a piece. So if you're feeling those abdominals working, you may notice how the breathing plus the abdominal recruitment actually is calming down your neck, and it should be a good one. There's ways to progress this to become harder. So if you go into a 90-90 hold, there you go, a little bit harder. Even just holding that while breathing may be challenging enough. You'll feel this more. And then to increase the difficulty, can you alternate lowering one heel towards the floor without letting your pelvis move, and then bring it back up, and then the other one. So you'll feel a little more work. The leg is the weight that makes the abdominals work harder, but it's all about the core in the front rather than
So if you
the
straighten
legs.
the
Yeah,
legs
this is
even
great
harder.
because we usually are using this also for the lower back. So good that actually you're applying this for the whole neck.
Yeah. Yep. And that's, that's where it comes down to the assessment of why someone has neck pain. Is it because their core isn't functioning the way it needs to? And many times that is the case. So getting some muscles in your abdominals to wake up and realize what they're supposed to do can really relax a lot of the tension that comes there. Plus, breathing calms down your central nervous system, which can be one of the reasons why people hold tension in their neck and shoulders.
And I think definitely as you get tired, my tendency is to then allow the
Yep.
arch,
Yeah.
right? So kind of.
So that's when you take a break.
Remember to.
Yep. And a really short, like 30-second to a minute break is valuable to be able to do another set and another set. A 10-second break probably isn't enough if you're actually fatigued and you're feeling it in a place you shouldn't be.
That's great.
So, yeah, usually I'll have patients in the clinic and I'm like, okay, take a rest. And they rest about 5 seconds and they go, and I'm like, no, like actually rest 30 seconds. Like let your blood kind of recharge, pull out all the stuff that shouldn't be there, put in new stuff, and then you're ready to go. 5 seconds isn't enough for that to happen.
Okay. Even if you feel ready for it.
Even if you feel
mentally.
ready, your physiology needs to recharge. You need that nutrition in your blood to get to those muscles and the stuff that was already used up to filter out and go back to the lungs.
Okay.
So, all right.
Cool. All right. Next one.
That's that one, and then the last bonus one
Bonus
is
one.
a wall angel, and this one's really easy to do if you're at work, you can't get on the floor, it kind of combines all of the ones we did all at once. So what you're gonna do, well, I guess I could demonstrate it, but I'll have one of you because I get to talk. I rarely get to do this, I usually demonstrate first. All right, so you're gonna stand against the wall, or you could sit in a chair. We don't have a chair right now. So if you stand, but you're gonna squat down a little bit so your whole spine is in contact with you don't have to do a chair, so that's mean. Come on up a little bit. So you're gonna stand more than sit,
So-
but you kind of want to tilt your pelvis so your low back is flush with the, and then your arms are gonna go up next to the wall. So you're already gonna feel a stretch.
Yeah.
And even just that might be challenging. So at maintaining as much of your spine on the wall, you're getting abdominal recruitment to keep your spine on the wall. You're getting an upper back thoracic extension stretch. And then as you bring your arms up overhead, you're gonna use your upper traps and you're keeping those abdominals tight and you're gonna exhale. So it's breathing here and then come back down. And initially you might look like Dr. Cooper. But as you do more, you might loosen up and be able to go higher.
Yeah. This was actually really helpful for my lower back,
Yeah, yep.
right? Because for me, obviously, I'm very tight. And one thing I need to work on is getting that greater mobility.
Yep.
This is great for that.
So T-spine is just a really important thing to address with anyone who's in pain.
Yeah.
But it can be good for neck and low back.
Yeah, and just keep on pushing through it. I mean, I don't really fatigue with this. It's just,
You won't, well, some people will.
Yeah.
Some people will get tired if you get higher. Even if your arms come off the wall and it's not perfect, come off the wall to see if you can go higher, but you're trying to keep your arms as close to the wall as you can. You're gonna feel those muscles right along your spine working pretty tough and hard.
yeah, I
It's
take
gonna-
it back. It does start to fatigue.
Yeah, so you'll get fatigued. And so some people can only do 5 reps, some people can only do 10, some
And
people
then
are
take
like,
a
"Oh."
30-second break and back and do a few sets of this.
And it might loosen you up, yeah. So this is one of those that you can fit in during the day as needed. If you're like,
Yeah.
oh, I'm achy, I'm sore, then kind
Yeah.
of try a few and do what you have time for.
When my lower back was really problematic, doing this and the other thoracic rotations was really key, which is surprising because my thoracic spine didn't hurt at all, right? But
Nope.
it's not surprising when you think through the whole mechanical chain.
Many times the location of pain is not where the real cause of the problem is. It's the pain is where the problem ends up and what gets the most wear and tear.
Right. Which is another reason why these are great exercises to do, and they're accessible and you can do them, but they don't replace having someone assess you one-on-one. Yeah.
But they're good to try.
They're good
They're
to
not
try,
really
yeah.
gonna hurt you. They're not really gonna hurt you. There's not much equipment involved, so
Yeah.
yeah.
All right.
That's it.
Fantastic. Thanks so much for watching. And please remember to like and subscribe to the channel if you did like the video, which I hope you did. And you could subscribe to help us continue to grow. Thank you very much.